work situation. What can you do to make life easier for yourself at work? Do you even want to tell people at work that you have bipolar disorder? And I've written a lot about this in my book, The Survival Guide, because it's one of the major questions I get. Should I be telling people at work that I have this disorder? My answer to that is only tell people at work you have this disorder if there's something you want out of that disclosure. If there's something, an adjustment you want to your work hours, your work responsibilities, how you're evaluated, how many breaks you take for medical visits, then I think it does make sense, because you're not going to get any of those things without disclosing. But if it's just because you feel like telling somebody, that's not the place to do it, because unfortunately people take that information and then when there's an altercation they say, well, you know, Jane has bipolar disorder. I don't know if the rest of you knew that. And then of course it's out on the table. Various practical things people can do: work in well-lit rooms. We know people with the disorder do better in lighted facilities. Sometimes people do better with a later start to the workday. Likewise, school kids with bipolar disorder, sometimes it's good if they can have homeroom when they go to school and not start math till 10 o'clock. Or somebody who's on a shift takes an afternoon shift instead of getting there at 7 in the morning. They may be on medications that make it impossible to get up early in the morning. Drugs like Adderall, for example, the stimulant for ADHD, kids report feeling extremely sort of wrung out in the morning, like they can't get up even though they want to. This is what we call sleep inertia. They can't move. And their parents are yelling at them, get up, the bus is coming in a half an hour, but they honestly feel like they can't move. Sometimes you can arrange a later start to the school day for the child. Finally, let me just say this for parents of bipolar kids. If you have a kid who's in primary, secondary school, it's important, I think, if you do decide to disclose the son or daughter's disorder to the school system, again, know what it is that you want out of it. Is it an IEP, so to speak, an individualized educational plan? Do we want him to be going to counseling sessions during the day? Does he need more time, more breaks? Does homework need to be broken into smaller pieces? The school is not going to do all those things, but they may make some adjustments with you if they know that he has a disorder that needs to be managed. There may need to be escape hatches, so to speak, during the day for the kid to be able to get away from teachers that are stimulating to him, or school situations, or rejection from schoolmates. Finally, let's talk about regular therapy and support groups. I certainly recommend support groups. The Depressive and Bipolar Support Alliance, high on my list. NAMI, National Alliance on Mental Illness. Various support groups, AFSP, American Foundation of Suicide Prevention, have support groups for parents and for people with a disorder. I highly recommend those. Educational lectures, you end up meeting other people who have the disorder or family members, and they often know of doctors or other people they've seen in the community that they find helpful. If you do join a support group, I think it's important that it involve a certain amount of what we call psychoeducation, information about the disorder and how to handle it, how to cope with it emotionally and practically, rather than just say an encounter, express your emotions type of group, which I think tends to be less helpful. If you decide to go the individual therapy route and you have bipolar disorder, great. But again, it should involve a certain amount of discussion of coping strategies, knowledge about bipolar disorder, and it should be at least weekly or bi-weekly. Most of the research we have suggests that regular therapy is going to be a useful adjunct to medication. So our particular approach is the one I've been talking about, family-focused therapy. We meet with families for 21 sessions, and we do 21 sessions with the patient and with the parents or spouse, very much like what we just did. We talked about how to recognize early warning signs, what the pros and cons are of adherence with medications, how to communicate effectively, how to identify problems in the school system or at work. And this treatment, sometimes it goes on for a while, but when it does, we find that the outcomes of the disorder are much better than if the person just took medications. So here's an example. This is the so-called STEP bipolar program. There's a lot of information up here, but let me summarize it in a sentence or two. We compared 3 different kinds of therapy to people who just got medication and a couple of sessions of counseling. These people got about 15 sessions of therapy, the more intensive therapy group, and those who got regular therapy in addition to their medications got over depression an average of 110 days more rapidly if they got therapy than if they were only getting medication and brief counseling. So getting therapy actually sped up the time before the person recovered from their depressive episodes. And we have, this is only one study, and we have many other studies that suggest this, and this was both individual and family forms of therapy. So I'm going to end just like I started with a quote from Kay Jamison, who says this about psychotherapy: "I cannot imagine leading a normal life without both taking lithium and having had the benefits of psychotherapy. Ineffably, psychotherapy heals and makes some sense of the confusion, reins in the terrifying thoughts and feelings, returns some control and hope and possibility of learning from it all. It is where I have believed or have learned to believe that I might someday be able to contend with all of this." Thank you. A little bit of shameless self-advertising here. I'd be happy to take questions.
We'll just make sure they repeat. Thank you so much, Dr. Miklowitz. That was just a terrific talk. Very practical, don't you think, and very helpful. Did it hit the mark? Good. I think we have some opportunity now for some questions and some dialogue with Dr. Miklowitz. So if you have a question, could you stand up and try to speak loudly, and we'll actually repeat it for everybody.
As we head into winter, the days get shorter and more darkness. Does that affect bipolar?
The question the gentleman asked is about, as the days get shorter, we head into winter, if you have bipolar disorder, what are some good things to do? A light box. You can get these light boxes, or sometimes they're called dawn simulators that go off in your room and mimic the light that you would ordinarily get. Some people decide to get up earlier and experience more of the day, go outside, get exposed to light at 7 in the morning instead of at 8 or 9. Try to spend more time outdoors if you can, if your job or life allows it, and try not to fall in the pattern of oversleeping, hibernating, which is what most of us want to do in the winter. Yes? Yes, sir.
Have you heard or do you know if extended periods of high blood glucose, particularly in a diabetic, can be a precursor or a trigger to episodes?
The question is, do high periods of blood sugar trigger episodes? Not that we know of. We do know that people with bipolar disorder seem to have higher than the average number of people with diabetes. I didn't say that very clearly. The co-occurrence of bipolar disorder and diabetes is fairly high, and I think that's partly because the medications cause weight gain, and some people develop diabetes as a result of it. We don't know that excessively high blood sugar leads to mania, but we do, on the other hand, encourage people to have a pretty balanced diet, because that in itself helps mood. Not to eat too much sugar, not too much caffeine, all the things you would usually suspect. Yes?
I got the impression that, from listening to you, that...
A little louder, please.
I got the impression from listening to you that children, that instead of saying that a child has bipolar disorder, you refer to them as having a mood disorder. Is that correct?
Okay, the lady is asking a question about is a childhood bipolar disorder, we refer to it as bipolar disorder or mood disorder. Not necessarily. There are kids who have bipolar 1 or 2 disorder, meaning they have the full syndrome even though they're not even 18 yet. And we've seen that in kids as young as 9 or 10. There are some people who say they see it in 5-year-olds. I have not seen such a kid. What I do see a lot of, though, in kids is a kind of undifferentiated mood disorder state where I see depression, I see anxiety, I see a little bit of mania, but not a full manic episode, maybe a little bit of learning disability, these kind of cases that look like kind of a mishmash of a lot of different things. We see that, that's kind of our bread and butter in our clinic, in fact. And we call that mood disorder because it hasn't declared itself as bipolar disorder yet. Does that answer your question?
Yes.
Yes. Yes, sir.
Would you display the website slide?
Yeah, sure. I think yeah, there it is. semel.ucla.edu/champ. There's a blog on there. There are a lot of informational sources. And at the end, you'll find space. I don't have them up there yet, so that you won't find them tonight, but in a day or two, you'll find them up there, and you can download them. Yes, sir.
Hey, my name's John, and
Hi.
first of all, I'd just like to thank you for coming.
My pleasure.
I participated in a fundraising walk for Americans for suicide prevention when I was living in Seattle. I really admire you for coming and giving us this outreach and all this information. I'm bipolar. I've been diagnosed with bipolar 1, and I've experienced a psychotic episode. I lost my father to bipolar in 2005. He committed suicide. And I guess my main concern is just the lens and the paradigm that we view mental illnesses in our society, and a lot of kind of the feeling I get from the pharmacologically based treatment is this, it kind of presupposes this idea that people with bipolar, I guess, have a problem that they need to get fixed, and have, like in lithium and other treatments, they're kind of a part of that. But in my experience, and like this relates to my own spiritual beliefs, my own experience with my father, but that bipolar and a lot of other mental disorders are blessings and curses. And it's kind of one of those things where, and it feels like to me that God makes us in a certain way, we kind of have to use our gifts and abilities the best we can. And one of my concerns is just that relying on these pharmacological solutions kind of changes us, like on a molecular, mental, emotional, spiritual level. And the paradigm I'm kind of exploring is one I've heard referred to as mad pride, and just this fight against mental health, stigmas against mental health, but also kind of like looking at a more holistic way to treat mental health. And I do want to commend you because I noticed that you included sleep, you included exercise, meditation, which I practice regularly, and also like exploring yoga and things like that. But I'm just kind of wonder, like, and I know I have my own biases, and I'm not like in any way trying to shame you or like anything like that. I just kind of like, what's your perspective on that kind of idea, that mad pride idea, or just like stigma against mental health and like?
Sure. Yeah, it's a good question. I'm not familiar with the organization, the position you're talking about, Mad Cry, but I would like to read more about it. I can tell you that there are people whose lives have been saved by medications. I don't have any doubt about that. I've had patients like that I don't think would have lived if they hadn't been on medications. I also agree with you that the pharmaceutical industry overemphasizes medications, and that life ills are viewed as treatable with pills. And of course, that's a very Western idea. That's not something you see as much in Eastern culture. The more Buddhist view, for example, is more about acceptance and living your life. But at the same time, people are in incredible pain, and I think we do what we can, and that's usually a combination of medications and therapy and lifestyle management.